Welcome to Health Professional Radio. Glad that you could join us for another segment. I'm your host, Neil Howard. Going to be in conversation this morning with Dr. Marcia Rabinowits. She's a licensed psychologist and clinical director at Rogers Miami location. She's joining us to talk about OCD, this paralyzing disorder, what it is, how to identify the symptoms, and she's also going to touch on how to get properly diagnosed and what treatment options are available and those that are most effective. Welcome to the program, Dr. Rabinowits. How are you? And thank you so much for taking the time.
Hi, thank you. Very happy and pleased to be able to talk about OCD as this is the OCD Awareness Week. And I'm glad to be able to educate and provide more information to you and everybody else who are listening to the show.
Is Rogers Behavioral Health only involved in OCD?
No. Rogers Behavioral Health, it's a non-for-profit organization across the U.S., but we treat OCD, we treat other anxiety disorders like specific phobia, social phobia, generalized anxiety disorders, and other anxiety disorders. In Miami, we also treat mood disorders like depression, bipolar. We have a program for kids that are struggling with anxiety and depression related to the ASD, kids in the spectrum, autism spectrum. But other locations, not in Miami, but other locations also treat eating disorder, PTSD, and they have inpatient, residential, partial hospitalization, intensive outpatient, many options out there.
A wide variety of treatment options available. Well, let's talk about OCD. What does OCD stand for?
So OCD is obsessive-compulsive disorder, and pretty much OCD is a mental health disorder that affects people of all ages, race, ethnicity, and pretty much occurs when a person starts getting caught into this loop or this cycle of having obsessions and or compulsions.
Now, is this any obsession or compulsion, or are there certain obsessions and compulsions that are classified as an OCD type of compulsion?
Yeah, that's a really good question. So remember, a lot of people make little jokes about being obsessed or being too neat or too, cleaning or things like that. So remember, having OCD is way more than that. This is when people are having those obsessions, which are unwanted, intrusive thoughts, images, urges that trigger a lot of distress and high levels of anxiety, right? So those obsessions, they occur over and over and over again. And the individual becomes very distressed and, like you mentioned in the beginning, pretty much paralyzed by this high level of anxiety and discomfort feeling. Sometimes it can come as fear, sometimes as disgust, sometimes as doubt, sometimes as a feeling that things have to be done in a certain way or in a just right way. But the main issue is that those obsessions and compulsions are consuming, right? A lot of energy, a lot of time, and people start being affected by it, and they start not being able to perform during the days, meaning they start not being able to go to work or go to school or turn in projects, or even being able to take care of themselves. So it can be very debilitating. And that's when people need to, hopefully even before it got to that point, but a lot of times when it gets to that point is when people start realizing that they need extra help. They need a professional intervention.
So it sounds to me that it's much, much more than a bad habit that one is trying to break, but it's not the same as an addiction, right?
Yes, you got it. So, like, going back a little bit to your question about, like, well, what kind of obsessions, right? I like the reason why I'm so passionate about OCD. One of the reasons is that I think our mind is very creative. And OCD can come in multiple ways, right? Obsessions can come in different ways, but the classic ones or the most common ones are related to contamination, related to religion, which we call scrupulosity, intrusive sexual thoughts, obsessions related to perfectionism, obsessions related to harm, obsessions related to losing control of themselves and acting like in a impulsive, horrific kind of way. So those are like the main obsessions, like the most common, I would say.
How do you properly diagnose a person's obsession and then get them effectively treated for something that seems to be extremely complex? Yeah.
So, like I was saying, a lot of the OCD comes with the obsessions and a lot of times with compulsions. Compulsions can be behaviors that people actually do, like washing their hands, checking, repeating, but they can also be mental compulsions, things that we do inside our head. And the main idea is that the compulsions have this kind of specific goal or motivation, I would say, that is to decrease that level of distress that I mentioned in the beginning that the obsessions bring. So it's like this cycle of having those images and intrusive thoughts in your mind that makes you feel anxious, and then you have the urge to act. You have the urge to do something about it, and when you do it, you kind of feel that relief. So then you feel like that decrease in the anxiety that then reinforces you to every time you have those distressful thoughts or fears or guilt or disgust to act in the same way. But what happened with time, like I was saying, is that the cycle gets bigger. It's like thinking about a tornado or a hurricane that kind of gains force that goes, let's say, through the ocean. I'm not like an expert. But so as you are doing this over and over and again, like the illness gets more powerful and it becomes more frequent, right? So then, like I said, it becomes debilitating and it starts getting on your way of being able to do things during the day, during, your everyday. So when you ask me like about being diagnosed, so when people go and look for licensed mental health professional, that can be a psychologist, can be a psychiatrist, a social worker, a therapist, a counselor, but somebody who is familiar with OCD. And then the therapist will be mainly looking for what are the obsessions, if the person is or not engaging in compulsive behavior, and if those are actually interfering with somebody's life, right? Is it debilitating? How much of the time is this taking? So, those are kind of like the things that the therapist will be looking for.
Can you give us a website where we can get more information about Rogers Behavioral Health and also about OCD during International OCD Awareness Week?
Yeah. So just before we end, like the appropriate treatment is cognitive behavioral therapy, which one of the forms is exposure and response prevention. That's the first line of treatment, with or without medication. So this is really important. So people can go to the Rogers Behavioral Health website. or people can also look more information at the International OCD Foundation website. And those are kind of like really good resources for people to start looking at.
Dr. Rabinowits, thank you so much for joining us here on Health Professional Radio.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.